Reported cases of the measles in East Texas. Cases continue to rise in West Texas. According to the CDC, 43% of hospitalizations are typically kids under the age of 5. KLTV7's April Peardon has more on what East Texas health leaders are saying about this outbreak.
A measles outbreak in West Texas is continuing to spread.
We've gotten to the point where yesterday they reported the first death.
Measles, an airborne virus, is one of the world's most contagious diseases, more than flu or COVID, and it generally affects children under the age of 5.
About 1 in 5 are being hospitalized. That's a significant number.
Russell Hopkins, Public Health Emergency Preparedness Director from NetHealth, says children should get vaccinated as early as possible.
The first vaccine of MMR would come in a year. Normally, there can be exceptions to that, and then it's followed on by another vaccine as the booster.
Depending on physician and the parent's decision, if a baby reaches a certain weight before they turn 1, they are able to get the vaccine. But it's not just kids who should be vaccinated. Experts say adults may need to check their vaccination status.
For folks who were born between like 1957 and between 68 to 72, when the measles vaccine became very effective, we may have unknown immunity status.
And if you were vaccinated between 68 and 89, you likely received just 1 dose of vaccine instead of the 2 doses, which is the standard today.
It's pretty important for everybody to be vaccinated,
especially those who are unsure about their vaccination status, who are working around children, or who are near young ones at home.
A lot of people, myself included, are around kids who are under a year have not been vaccinated.
Hopkins says the best defense against measles is vaccination. April Peardon, KLTV7 News.
Now, Texas schools and colleges do require the MMR vaccine unless parents file for an exemption.